Movember is back with a mission to improve men's health. Brian Heilman from the Movember Research Institute joins us to share key findings from their new report. Brian, good morning.
Good morning. Thanks for the chance to be here.
And I clearly have to work on my mustache game for No Shave November. So the new report calls men's health a family and community issue, not just a men's issue. Why is it so important to make that distinction?
Yeah, Justin, thanks. I mean, we titled our report The Real Face of Men's Health because we wanted to emphasize that real face is not just the face of a solitary man in the doctor's office. It's his network of loved ones who will be impacted by his health, right? So we can all think of our loved ones. If they're thriving and doing well, that positive impact radiates onto us. And obviously, if they're going through a health dilemma or a crisis, or God forbid, if we lose them too soon, it obviously has huge meaningful impact on us. So that's the lens we wanted to bring to the report.
It's well said. Why are men in the U.S. dying younger than men in wealthy countries, and what's driving this gap? Because it's startling to me.
Yeah, let's break it down. I mean, we found that 53% of men who died last year in the U.S. died under the age of 75, which is an international kind of cutoff point for what's called premature mortality. So we can say that the majority of men in the United States die prematurely. When you compare the United States life expectancy at the moment to the life expectancy among men in the country where men live the longest, there's about a 6-year gap. So this is not just as simple as men versus women or a simple biological explanation. Like, there is something happening in our country that, that leads to these kind of results. And if it were a simple answer, the report wouldn't be quite as thick as it is. We obviously get into a lot of the complexity of the US population, geographic trends and demographic trends, and where some of the root causes are. But for us, it comes down to just ensuring access to high quality healthcare in every community in the country, which is not currently the case. And also to break down those stigmas for men so that they feel comfortable seeking out care for both their physical health and their mental health.
You know, Brian, when we talk about men's health, it's often framed as a personal issue. But your report shows there's a massive economic impact from these health disparities. Can you explain how big that burden is and what's driving it?
Yeah, so we dug into only the five leading causes of men's premature mortality in the United States. And we added up the combined cost of hospital visits, healthcare provision, insurance costs, as well as the indirect costs when the men die of, lost productivity and lost work time. And you add up just from those 5 leading causes of premature mortality, and it comes to $420 billion, which is, a mind-boggling number to get your head around. It's the equivalent of if we were to start 1,500 new hospitals and run them for a year, just from 5 leading causes of men's premature mortality. So this is what we're trying to do in the report, is take it from just thinking of an individual man to explore the family, the community, and even the economic impact.
Yeah, that is a mind-boggling number. Behind every man's health story is often a caregiver, usually a woman. What do we need to understand about their sacrifices and struggles? They're a huge part of it too.
Totally. I mean, whatever amount of time a man is in the doctor's office or in the hospital is a small minority compared to usually the time they're spending at home and needing that more informal care. So we interviewed over 2,000 caregivers for men, most of whom, but not all of whom, were women. And it just shows how interconnected all of our health is, right? The caregivers themselves are talking to us about financial health impacts, emotional health impacts, curtailing of their own social connections and social lives. So, our health is intertwined. Of course, the caregivers also do share, and it's important to mention this, an increased sense of connection and bond with the man they're caring for. So, care is work. It can be a burden, but it's also an essential part of showing love and part of the relationships that we have.
Mental health and loneliness are huge topics in your report as well. Why are men struggling more than ever, and what can be done about it?
Yeah, I think across the life course, right, there are trends driving loneliness and isolation. We see young guys moving more and more of their social lives online as opposed to in person. As you age and lose connection with your close friends, or as your friends start passing away, there's just isolation and loneliness at every age among men and among women. I feel like in the current moment, especially coming out of a COVID lockdown, social isolation, social distancing period, a lot of people, regardless of their gender, are feeling lonely. The distinction for men is then when you combine it with that reluctance to seek help or to open up or to have somebody in your life to turn to in those moments. So men are both lonely and not really doing anything about it, which is a particular challenge.
Brian, your facial hair is looking pretty good. I need some work here for No Shave November. All right, I'm going to try my hardest this entire month. Thanks so much for sharing those important insights. And if you want to learn more or get involved, head to Movember.com.